Good evening, everyone. At the outset, I would like to thank the organizers for giving me this opportunity to present about parental anxiety of hospitalized children and management. The importance of children's psychological well-being of parental proximity and involvement in the care of their hospitalized children has been recognized for many years, with recommendations for daily hospital visiting by mothers being made in the year 1940. A study was done by Davis in 2010, and we know that parents they have lot of issues and challenges, even normal to bring about normal children, and especially when the children become sick, it causes a lot of stress in them. And they have various other problems like changes in the routine, and they have to be backed up financially, and various other difficulties. Sometimes they do lack social support, and so they have to manage all alone. And besides all this, they do have anxieties about their children's diagnosis and the various investigations the child has to undergo, for which they have to be present physically, and it really taunts them emotionally. And so they present with various manifestations, and some of them they become so anxious that they all the time expect the worst. Will my child be all right? Even if it is a minor problem, they anticipate major things and expecting the worst, and avoiding behaviors. Some of them tend to be isolated, they don't talk, they are very secluded, and they don't take care of themselves. Their ADL gets affected, they don't eat, and they look so dull and depressed. And vocalize, some of them do vocalize their anxieties to the child, and they keep on ventilating, especially if the child happens to be a schooler or an adolescent. They keep on ventilating to the child, especially if the spouse is not okay, or if they do not have enough social support. Then the vent becomes like their children have to be the source of ventilation. And parental burnout, some of them really go into the burnout kind of a stage, and some of them overreact. I do remember in one of the wards, one mother was literally hitting the child. And when we stopped and intervened, we found that the child mother was in depression, and we had to seek psychological psychiatrist intervention. And we had to call for a psychiatrist and consult, and all these things happen at times. And some of them, they get distracted because they're not able to take on much on themselves. They try to get distracted, they disappear from the ward, and we have to call out either for the father or for the caregivers, and sometimes even the neighbors and things like that. So how do we measure their anxiety? Actually, there are many scales to measure their anxiety. One spends children's anxiety scale, which also measures the parents' anxiety. And there are many standardized scales available, and so therefore we can use one of the standardized scales in measuring their anxiety. And based on the results that we get, we can adopt our intervention modes. So, however, it was not until the findings of Platt Committee in 1959 by the Ministry of Health in 1959 that the issue gained significant prominence, recommending the parents to be allowed to visit whenever they can and to help as much as possible with the care of the child. In ICU, we do have restricted timing for the entire family. All the time, one parent can stay, either the father or mother can stay. Nighttime, we do allow only the mother to stay on. Daytime, either the father or the mother can stay. And visiting time, where the kin and kid, the neighbors or the family members, other extended family members, they can come only 1 hour in the evening. Every day, we allow them to come 1 hour in the evening. Whereas in the wards, they have a kind of turnover, and so there also we do have a restricted timing, but one of the parents can stay nighttime, fathers, and daytime the mother can stay. So a recent systematic review, which was done by Parr and Frank in 2008, confirmed previous findings of parents' desires and expectations to participate in their child's care, and showed how the nature of their participation has evolved. When we involve them for the care, either for bath or any simple procedure that we do, when we involve them, they really feel lot good. They feel that they are involved, and even for decision making, for that matter, we get them onto the team and we ask them for their own kind of decisions. we do give them, if they struggle, we do give them some alternatives, and to pick and choose. And especially the team, the physician and the team members, we explain the best options, and they're always given chances and choices to select the best among the interventions that are told to them. In terms of parental adjustments, parents of very ill children, such as neonates, a study done by Shaw et al. In 2006, and children in intensive care, a study done by Balafi et al. 2004, and Colville et al. in 2009, and Needle family, their team members in 2009, or children undergoing specific surgical procedures. This was done by Frank et al. In 2010. So many studies have shown high level of stress for parents, especially if they happen to be in the surgical unit or in the high dependency unit and the intensive care. And therefore, we have to intervene to reduce the anxiety of parents. It is most important functioning or function of the pediatric nurses who are working in the pediatric unit. So, the importance of children's psychological well being, of parental proximity, and involvement in their care for their hospitalized children has been recognized for many years. A recent systematic review by Powerwalk and Frank in 2008 confirmed previous findings of parents' desires and expectations to participate in their child's care, showed how the nature of their participation has evolved. And so, what all can be done to reduce the anxiety? First and foremost is communication. Clear communication is very important. And when we explain, especially the doctors, when they do explain about the child's diagnosis and the prognosis, and even as nurses, when we interact with the mothers, there should be honest information from our side. And even if the prognosis happens to be not favorable, the doctors explain, and the reinforcement done by the nurses, always honesty should be kept intact, which is the core ethical component in our care. And so, explaining about the child's condition, the treatment plan, and expected outcomes, transparency can help build trust and reduce uncertainty. Regular updates, visiting them in the morning. The physicians, they do visit twice a day or thrice a day. And as nurses being there all the time, we must make sure that we pay frequent visits. Of course, we do atraumatic care, and we try to club up all the care for the child in order not to disturb the child. But then visiting the parents often is mandate, so that they will be able to ventilate their concerns. So, transparency and also regular updates and regular visits with good communication, open communication, and honest communication helps reduce anxiety in parents, keeping them informed about any changes, and even a small procedure that's being done. If it is explained well, then definitely that allays anxiety in parents. And scheduling updates can also help manage expectations. And emotional support and empathy. I remember one of the children, he was just drawing up, preschooler actually, drawing up on the paper, and I saw him draw a small circle with two horns, and I just intervened and asked, "Who are you drawing this? What is that you're up to? Who is this?" And the child was saying, "This is my max teacher." No, like a circle, a figure drawn with the two horns, and uh, that is how they try to express their concerns. And one other child was drawing about a nurse. This happened to be an adolescent kid, where he was drawing an angel, and I asked him, "What is this? Who is this?" And he was saying, "This is the nurse," and that child happened to be in oncology unit. So when we want to tap out information from even the parents, especially when they struggle finding out what is in children's minds, especially for adolescents, if we just put our hands around and keep them at our level, sit at their level with good eye contact, and treat them as friends, they try to bring about all their emotions, and whatever is hidden in their hearts, it just comes out. And for smaller children like toddlers and preschoolers particularly, we can just give them some pictures, and they try to draw figures, and through that the mothers can find out what is going on in their minds. I remember one other kid, he was just beating up a toy, a doll, and I was asking, "Why do you do this?" And he said, "See, I am this kid. No, I am this kid. I don't know, I'm a bad kid, and therefore I'm just locked up within this four side rails, whereas my brother is a good one, and that's why he's at home." So children do have a kind of guilt feeling, and the parents also have guilt feelings. And when we intervene, and that was the just first hour of admission, and our nurses along with our team, we intervened, and the child became all right just within 2 sittings of counseling and things like that. So it is so important to parents struggle to tap out those kind of emotional feelings from the children, and we can teach parents, give them tips how to get the emotions out of children, what do they feel, and so all these tactics can be taught to the children, to the parents. And empathizing with the parents feelings and their emotions and their struggles, it's very very important. And as pediatric nurses, we must make sure that we sit and spend enough time with them, allowing them to vent out their struggles. And even if they require some kind of solutions, we can give them alternatives where they can pick and choose. And if they require some kind of help, like financial support and so on, actually in our hospital we do have a provision where they do write off for patients who cannot pay. They do write off for patients. We have PTP funds and various other modes where they can be written off and they need not pay, assessing their socioeconomic status and so on. So parents can be helped by different ways. And so acknowledging their feelings and recognizing and validating their feelings of anxiety and stress, understanding their emotions can help in providing more targeted support. And providing emotional support is very very important. Just simple listening or empathizing with them, a kind word, and just finding out whether they had a breakfast or small things, just a small conversation makes them feel so good, and they feel at home, and they feel that they are literally taken in as a family member in the hospital. Family centered care. In our society, we do have a kind of social support system where the aunt and uncle and the grandparents, they do visit. And so especially during the visiting hours, we can see the entire community come and visit the child. And so involving, when they come, they should be welcomed and they should feel that they're part of the team. And so when we explain simple things about the child's condition, things like that, that matters a lot, and that gives a lot of comfort to the family, to the parents, and also to the family members. So involving parents in the care of their child as much as possible. And then this can include simple tasks like assisting with daily activities, or it helps parents feel more connected and in control. Educating the parents, we do have in our wards, we do have pamphlets. Our students who are posted in the ward, our staff nurses, they make a lot of pamphlets on different disease conditions, about home care, about management of various ailments. And also we have flashcards, panel boards. So there are different modes, and now technology is in hand, and so even that can be used in teaching the parents how to manage these children at home, and when they should come, what are some of the danger signs to look for, and when they have to approach us, and things like that. So, patient education, providing parents with clear and understandable information about the child's condition in simple language, about the treatment and any necessary procedure. This can actually empower them, and it will reduce their anxiety. Hospital resources, familiarizing the patients with hospital resources. They're totally new. Some of them, they pay revisits, but most of them are just, it's a first hospitalization experience for them, and therefore we need to orient them about the various facilities that are available in the hospital. As well as we do have groups, like we have a chaplains department where the chaplains visit the patients regularly. And even our own nurses, they pray with them in the morning, and even otherwise in between whenever they require. And there are counseling nurses available. So there are different modes and of resources where educational materials, like we have bibles and whatever. So we must be able to make it possible for them to access, so that this can really allay their anxiety. And knowing where to find this additional help, that will be more reassuring for the parents. Creating a comfortable environment, welcoming atmosphere, fostering a welcoming and supportive environment within the pediatric unit by having a open access, short communication, and so on. It also will definitely help allay anxiety. And preparing the parents for discharge planning actually begins at the time of admission itself, we all know. So every day, instead of bombarding them with too many informations at the time of discharge, right at the time of admission itself, every bit of information can be given step by step, assessing their background, their educational background, how much they can take on, their anxiety level, and various other components to be assessed. And then step by step we can give them education about the child's condition, about the follow-up and how to manage and various other concerns, and even about the how they can contact us as healthcare members. Actually, our nurses, they're too good at, they given their numbers, and especially we have parental support group, and where they themselves connect to each other, and any queries any time of the day they can contact the ward. And so such facilities are available, and we do have emergency unit. Anytime there is a problem, the child can be brought forth immediately to the emergency care center, and the child can be well taken care. So we do have facilities, and therefore that gives them a lot of relief. Oh, somebody is there for me, some healthcare professional, either it's the nurse educator or the uh, primary nurse or the nurse manager or the nursing faculty, and the other healthcare members also, definitely the physicians and all the other support staff people are there, and other healthcare team members like dietitians are there, psychologists, sociologists. We function as one family, and there is always a kind of give and take in the team. And so the patients feel free to approach us, and anytime they can approach, and they will be well taken care. Addressing the cultural and religious needs, they come from different background, and therefore we are very sensitive to that. We do pray with them, we do share the gospel, and in a very sensitive way, and understanding and respecting their beliefs without shunning their feelings off, and without disrespecting their background. We try to communicate the love of the Lord, and so that also definitely plays a big role. And technology and remote communication, we do discourage children using technology for a long. If they want to use not more than 2 hours with the cell phone or with the laptop, where it should be under supervision, because they're still children, and especially smaller ones, or even otherwise it can cause a developmental delay or psychological problems if they are going to be long term on the net. And so we tell them not more than 1 or 2 hours, and it should be a supervised kind of a deal. But for parents about to learn, we do allow them to use technology by themselves, and making virtual visits and giving them advice, especially to the parents, the father and the mother, and even to the other family members, to relay anxiety and fears related to child's hospitalization. So in conclusion, I would like to say that parents of hospitalized children undergo a lot of trauma and challenges due to child's condition, change in the daily routines, financial burdens, fear of unknown, social stigma, etc. And parents need to ventilate their fear and anxiety. Nurses being with them will be able to better understand their struggles and can empathize with them and take measures to reduce their anxiety. And actually, projects are being done on this. Even recently, one of our students did a project, and it's it to be released. And so we can do projects wherein the evidence based, the results can be incorporated in order to improve our modes of reducing anxiety in parents. Because definitely anxiety in parents, it's going to reflect on the care of the child and the outcome of the child, the prognosis of the child, and so on. We know that well, and therefore it should be taken as a very serious concern, and all healthcare providers, and particularly pediatric nurses, must pay more attention in reducing anxiety when they care for their children in the hospital. Actually, I would like to thank the entire team for giving me this opportunity. And always, there is a learning take home message for me, which I always look forward to. Thank you, especially for the team. Thank you.